first, an omission. I was introducing Kelly Rogers, and we have Kelly to thank for introducing us to retired Brigadier General Kathleen Flarity. Kelly serves on the board of the Marcus Institute for Brain Research, so thanks, Kelly. I'm really delighted to introduce Kathleen to you all today. Executive Director of the Marcus Institute for Brain Health at CU Anschutz. She's also the co-founder and Deputy Director of the CU Anschutz Center for Combat Research. In her spare time, she's an Associate Professor of Emergency Medicine at the CU Medical School. Kathleen was one of the first women enrolled in the Army Airborne School at Fort Benning, Georgia. She then served as an Army combat medic with multiple deployments, including directing the critical care air transport teams during Operation Desert Shield and Operation Desert Storm. Returning stateside, she had key roles with the Aerial Medical Evacuation Squadron at Air Force bases in Washington State and also in Arlington, Virginia. She later was the first commander of the Air Evacuation Squadron at Peterson Air Force Base in Colorado Springs. Her final assignment was as a Brigadier General serving with the Command Surgeon Air Mobility Command at Scott Air Force Base in Illinois. Please join me in giving a warm Rotary welcome to Kathleen Flarity.
Thank you so much, Jerry, Bill, and everybody. This is a room full of overachievers. I already know that right from the beginning. So thank you for everything you do to support so many wonderful causes. And I'm just totally honored to be here to talk to you about the Marcus Institute for Brain Health. And thank you to Kelly Rogers, who's founding member of our MIBH Impact Board, who coordinated me with Jerry to be here. So I am just thrilled to talk to you about the amazing mission that we do at the Marcus Institute for Brain Health. And Jerry had mentioned that I'm also a co-founder for the CU Center for Combat Research, and that is, we established that in 2019, and with that we do military medical relevant research. So we fill the gaps of the Department of Defense to get after what our warriors and our warrior medics need for the next large-scale combat operation. So it's an honor to do that. And I did get promoted to professor, so I got that going for me. So one of the things that Jerry had mentioned is I did start when I was 12 as a combat medic, so that's one of the reasons that I could serve so well. And it was an honor to be a woman leader in a lot of the, breaking some of the glass ceilings and barriers, and I've learned everything along that way, right? And so one of the things I've learned is, I don't want to just be invited, I want to be integrated into it, and I had big fun proving myself again and again, right? So if you can imagine me at 110 pounds with 85 pounds of airborne gear, and so I've since had 2,800 jumps, so done a lot. And so I've had the honor of doing really high impactful jobs. The one on the right is I had the honor of serving as Air Medical Evacuation Commander, responsible for the AE and all the critical care and transport teams at Bagram, Afghanistan during the height of the conflict, and flying a lot of those combat missions myself. And then retiring as a Air Force General. But I'm just really proud to continue my service to this great nation and to our community, to continue the work that we're doing at the Marcus Institute for Brain Health. I do want to start with this little video from one of our patients, Ray White, that talks a little bit about our mission. Oh, thank you.
My name is Ray White, Raymond White, and when I was 27 years old, I went into the Army and did MLRS for a few years, but then EOD opened up and I went to EOD school and did 21 years in the military, 5 deployments.
This place saved my life, absolutely. Like after I retired, it was really
kind of starting, I did a contracting job in Kuwait for a year, easiest job ever for the most money I've ever made. And I was just falling apart, you know, and I got home, best situation of my life, wonderful wife, family, happy, I had a big workshop, no money problems, like, you made it, you know, 5 times and a lot of close calls, but you made it. And every day it was just like, how do I not start a 9 mil? You know, like every day. And I'd never had depression. I'd never had any of that stuff. And I was just, it was really just a matter of how long do I go, you know, before, I mean, I couldn't go out in public, my kid's basketball game, just a complete mess, like just, and I didn't get it. And then my wife came in on me at a time with a pistol in my hand and no good explanation from me. And she said, look, whatever it is, we just gotta fix it. You know, like, I don't know what it is, you don't know what it is. And so I went to a neurologist and he did a brain scan, said, yeah, you have you have traumatic brain injury for sure. And he said, there's a place right here in Denver called the Marcus Institute for Brain Health, and they have the best for you. That was what overwhelmed me when I came here, is like the amount of best in their field people that there were 5 of us.
Yeah.
And they all worked together and they were just here for me. And they're just pouring into me like I'm the only thing that matters. You know, it's like a lot of it was, you know, you think, how do I get this? You know, it gave me that hope, that roadmap, that toolbox to, you know, say, crap, I got to build another house, you know, or climb another mountain, but I can do it, you know. So that's what the Marcus Institute did for me.
Thank you. I'm honored to say we have hundreds of stories like that from veterans, service members, and first responders that we serve. And so we take care of patients, and for the veterans, they don't have to have they don't have to have an honorable discharge, because we know a lot of these patients have had psychological health issues or traumatic brain injuries that were undiagnosed. And so we take all those patients, we take them from age, our youngest has been 21, our oldest has been 84. So we take all along that continuum from currently serving to Vietnam and vets as well. So a traumatic brain injury is a disruption in the normal brain function caused by any insult to the head. And that can be 2.8 million people annually in the United States get a traumatic brain injury, but it's more common in our first responders, our veterans, and our military members because of the nature of their work. And it doesn't, one of the ways that we diagnose traumatic brain injuries is I think it does a fallacy of saying what the level of injury is, because at the time of injury, how long you're unconscious and how long your amnesic traumatic event is, like how long you can't remember, gives you the rating of mild, moderate to severe. But I will tell you that I've treated hundreds of soldiers, sailor, airmen, Marines with traumatic brain injuries, and we've served many at the Marcus Institute for Brain Health. They get labeled with mild, but their symptoms are negative, affecting every aspect of their daily activity, and it doesn't go away unless they receive treatment. And I know people with moderate to severe who are totally functioning normally. And one of the things, for far too long, traumatic brain injuries have been misdiagnosed as psychological health issues. So a lot of these patients maybe not have had that one big traumatic brain injury, maybe they've had multiple repetitive blast injuries, which I'm going to show you a video in a minute. And so a lot of times they just get labeled as you have PTSD, because a lot of the symptoms are very similar. They can have anxiety, they can have, and traumatic brain injuries alone can cause anxiety, depression, and cause PTSD. And for me, I believe our suicide rate among our veterans, service members, and first responders has a lot to do with the fact that they have undiagnosed, untreated traumatic brain injuries, and those symptoms, those all-encompassing symptoms, never go away. And they are suffering, but they don't have hope or a roadmap to that recovery. So symptoms can be similar, as I mentioned, anxiety, but they also anger, low frustration, tolerance, irritability, some of the same symptoms as PTS. And so one of the things that we are very interested at the Marcus Institute for Brain Health, because we not only treat world premiere that I'm going to talk about in a minute treatment, but we also do research in this realm. We are on the cutting edge of what our currently serving service members and our veterans and our first responders need. So I just want to share this. Oh, I forgot I have to.
The coolest thing about my job is definitely blowing stuff up.
It's like a wave of energy just rolling over you.
So a lot of these in training, in combat as well, but in training, these repetitive blast injuries, when they do these breaching, all the training breaching, when they do shoulder rocket fired weapons, grenades, all the training, they can get these low-level cumulative blast injuries and then blast overpressure. We really didn't know about this. I remember in 2003 when I first noticed like traumatic brain injuries that they're just not thinking clearly, they have fog, they have all these symptoms, but we would just send them back to duty and not recognizing it. And if you don't recognize it, don't identify it, you don't diagnose it, they're not going to get treated in it. So one of the things that we're very interested in our research base looks at some of this repetitive. So like for this, if you watch this guy when he shoots the rocket, you could see that he's going to have this blast overpressure that years past we would think, okay, they got a ruptured tympanic membrane or eardrum, or they have blast overpressure in the lungs, but we didn't really have that correlation of what's happening inside these brains, in the brain. And think about this with our SWAT and our police and a lot of these others with repetitive.
When a weapon is fired, it creates an explosion that produces a wave of energy. It's a high-pressure pulse which passes through the whole body, including the brain. The effects of high-level blast exposure are more obvious, but scientists have now found repeated exposures to blasts, even at lower levels, could lead to mild traumatic brain injury, or MTBI.
So as I mentioned, for us, we started, we'll talk about the traditional program, but we started a program looking at currently serving special operations that get the repetitive blast injury, and other ways, and we're working with the DoD and the military leadership to how to prevent and mitigate things that are in our circle of control, right? You got to train like you fight, but what can we do now to protect these soldiers, sailors, airmen, and Marines? And this is a study from 2023, and 47,000 active duty and reservists on active duty that had traumatic brain injury. 89% of them were labeled as mild traumatic brain injuries. 2 years later, 2 years after their injury, and again, mild, which a concussion is a mild traumatic brain injury. So they still had cognitive disorders, the majority, sleep disturbances, post-traumatic stress, emotional disorders, and anxiety disorders. Again, if you don't, you can't give them back their life. TBIs, traumatic brain injuries, is known as a signature wound of Iraq and Afghanistan because our body armor is so good. People are living, but they're living with injuries, right? And the traumatic brain injuries is one of them. And so part of it is, like, I look fine, right? You don't know, I'm gonna perform, you don't know that I've had a traumatic brain injury because for a short period of time, I can perform quite well, right? But I might be having headache, fatigue, sleep disturbances, overstimulation. So a lot of these patients, and a lot of in the community, they just go to quiet. They go to their basements, they stop socializing, because one of the hallmark signs of traumatic brain injuries or even concussions can be overstimulation. So when you go to dinner, everything in the world falls around, and I'm just here at dinner with Heather, right? Everything else falls away. Somebody with a traumatic brain injury will hear the dish crash, they will hear the sound over here, they will have movement. So for now, instead of sitting with their back to they can see the door, They can't do that anymore. So now they're hypervigilant, and they now got to face a wall where all they can see is Heather instead of the movement, the sounds, and all of that. So even grocery shopping can be an event where it uses their cognitive and physical load just to go shopping. So they stop showing up for things, and they don't know the reason, right? They're saying, oh, you just have anxiety, you just have a post-traumatic stress, you just need to see behavioral health. So all these, they can have ocular, motor, vestibular, all these things that really have a negative impact on their life, but you do not see it. And so part of the cognitive, so there's cognitive, physical, and there's emotional. And with cognitive, it's emotional. It's cognitive flexibility, be able to multitask, new learning, that constant fog, maybe even some memory processing or learning attention. So they were a high performer. They still look like they're a high performer, but they know they went from here to here and they're not performing. And they might keep up their, able to perform at work, but then they have nothing left to give to their family when they get home. So the Marcus Institute for Brain Health gives that new hope to TBI recovery. What we do for these patients is we use mostly philanthropic funds, but we fly them in. We have this amazing assessment team that goes through their whole history. We get their medical records, we get their CAT scans, we get everything about them. But our team will go through and say, do you have a military occupational specialty code that says maybe you didn't have that big TBI, but you have been a mortarman, you have been exposed to 4,000 huge mortars once a year for that repetitive? Or are you a police officer that has had bell rang 3 times and never sought treatment, and then you have your continuous firing? So we pay for their travel, that's air travel. We pay for Uber to and from the airport. We pay for the assessment and treatment that I'll talk about in a minute. We buy neuroprotective, healthy foods, teach them how to get, to decrease inflammation by healing your gut microbiome. So we give them nutrition and as well. And then we lodge them on our campus. I'll show you a picture in a minute. So one of the things that this team is uniquely able to do is meet them where they are. And every traumatic brain injury is individual. Not everybody's, even if you went through the same vehicle with your car crash, it's going to be different because where your head was, in what rotation, what your health is going into it. So everyone is individual. And so we have this amazing high-performing team, and I've worked with some high-performing teams, and I will tell you, this is an amazing team. And we are co-located in a couple buildings, so these patients come to us, and we have a neurologist and a physical medicine and rehab doctor, a PharmD, clinical pharmacologist, who looks at what meds, because the VA is really good about polypharmacy, giving you 20 meds that probably not the best for you, so how do you get off of those? Neurophysical therapy. We have a cognitive specialist known as speech language pathology. Integrative therapy. We have a canine program from Canine Partners of the Rockies, so where we got our Buffy from. We have equine. We have art therapist. So she's a true therapist that does art, because we know that these nation's heroes have a lot of stored trauma. And the thing about the combination of behavioral health, psychological health coach, and art therapy, it can release traumas, acknowledge them, release them through art therapy, behavioral health, nutrition, sleep, and then veterans and community relations. So we have, this is one of our cohorts that graduated recently. Okay, I missed something. So part of on our campus, we have Colonel's Row. So the middle of CU Anschutz is the old Fitzsimmons, so it's old Army base, old hospital. So we have Colonel's Row, which is lodging 2 Colonel's townhomes that we converted to a housing for them. So they come to us. Perfect. They come to us for 3.5 day evaluation. So we've already vetted them. We think we can help them. They come and they see the specialist team. And the patients at first, they come to what's called a fishbowl. So the patient will tell their story, and they only have to tell their story once, and the whole team hears it. We've already looked at all their charts. We think we can help them. And then they see each one of these specialists. So they can have a neuropsychologist that will have 5 hours of looking at cognitive functioning, each one of these to assess where they're at. And then they come back, and the same team will meet identified your area of growth in cognitive. Here's how we think we can help you, or these are things that community. And for neuro PT, we have a lot of validated tests, and where their baseline is, and then whether we can help them. And then about 80% of those patients come back to a 3-week intensive outpatient program, so they live with us for another 3 weeks. They have individualized precision medicine based on their types of injuries that are going to help them get better. And I will tell you, because I do a group session with all of the patients, all of them say they get hope. And just that 3.5 day of evaluation, they're like, I am not crazy. I don't have to live the rest of my life like this. There is ways that I can, and I will do the work, because this group will do the work if they know what to do. But to have 32 hours of treatment where they just go across the hall, individual and group treatment, and I'll tell you that cohort model of all of them living together in the house, cooking together, some group and some individual work, they got back their community. They got back their tribe, their team, and a lot of these cohorts stay in touch. Every Sunday they get together on a Zoom. They're there to support each other and give that background. And then the other thing that since I've only been there since last February, and it was because of my success with the Center for Combat Research, the chancellor asked me to take over the program, and it has been not just a mission or a calling, but it is my life's work, and it's like such a gift. I'm exactly where I need to be doing exactly this work, and I'm so passionate about it. And watching the change in the lives, like watch Ray go from, and I can't tell you how many of them, like it was the end. This is my last piece before I was gonna do something like Ray talked about. So thank you for your time and attention, and we have some time for questions.
Thank you, Doctor. Thank you for your service and the wonderful program you're leading. Do you have your spouses involved in the program too?
Thank you. Yes, we have a family program. We used to have family come onto campus, but what we found now, because the families are at home for 3 weeks, right? The kids and everything else, and so we do a lot of virtual. So we teach them like TBI 101 so they can understand how to support their patient. The other thing that I didn't mention was we do a lot of wellness practices. It's amazing, and I've always worked to offset this in the military, is we'll give them all the tools to go fight, but not how to take care of yourself. How to work with those moral injuries, how to work with the things you've seen, like how to do that. So these people, and it takes 3 weeks to change a habit, so we get 3 weeks to really work on those wellness practices of how to downregulate in the context of a perceived threat when you're, in fight or flight or sympathetic and somebody's yelling at you at the gas station, right? How do you work with those? And so we're really good at that. So thank you for that question. And then they come at the end of the 3 weeks, we have a completion ceremony, so families come to that, and they can come in person or they can come virtual to a lot of the training. Like PT will meet with the family, speech language, the different disciplines will meet with the family members. And it's self-identified. Their family member might be a best friend, it might be an uncle, it might, whatever that looks like.
Thank you. That was just a great presentation. You said you're exactly where you need to be right now. I have a question for you. A few years back, and based on your resume that you just went over, when we were evacuating people to Germany out of Iraq and discovered that the airplanes without the pressurization was increasing the problem with the brain injuries, the TBI. And there were some published papers out of the military. Did you have a hand in that, or is that?
Yeah, I know those authors, and a lot of it is we didn't know what we didn't know. Most military aircraft pressurized between 5,000 and 8,000, so you're all at that pressure. And so some of the studies that we've done subsequent, we do, like a couple of the big studies we've done in ICU, at Denver Health and University of Colorado Anschutz, which are a little bit of that 5,000. So we have more information than we have back then. Thank you. Oh. Thank you so much.
Thank you so much for this presentation. As a clinical psychologist, I've worked in post-war zones, and the question I have for you is that in our group work, we use several different modalities. One that was very effective was like what you said, art therapy, which was really interesting to all of us. But the other was we had them journal writing.
Yep.
And what was really interesting was that the ones that printed in their journals didn't heal as fast as the ones who used cursive writing in their journals. So we were interested in that situation. Do you have anything to say about that?
We have a study that actually looks at journaling, and we look at it military members who were, it's called the WET study, hospitalized for suicide, right? And so that was a captured audience. And so there's been lots of studies that have shown sharing your story.
Right.
And, and it's how you share it. So some of them do it in art, some of them do it in, individual, but that's why journaling, because it gets those thoughts and it gets,
right.
I did not hear the cursive versus writing. The interesting thing is we have generations of kids who never learned cursive.
Yes.
Yeah.
Yes.
Yeah, that would be fascinating to look at it, yeah. Yeah, yeah. Yeah, I've 45 years in emergency medicine. You can't read anything I write, but.
Thank you very, very much for your presentation. I was a counselor at Fairview in the 60s when Nam veterans were coming home. And we were desperate for something that you've developed now years later. But I've stayed in touch with some of those students, and they've had a big struggle, but there are many, many more support systems for which I am forever grateful. And so I am particularly to you, and I left counseling to go into the legislature to see if I couldn't make changes there.
Awesome.
Nothing came easily, but eventually things are really happening, and I'm most grateful to you and others. Thank you, thank you, thank you.
You're very welcome. It's an honor. It's an honor to continue to serve. Yeah. And thank you for what you did. And our Vietnam vets, as you all know, got a raw deal of it. And one of the things we know about Vietnam vets is their story, but then the person listening get upregulated, and they're like, you, I'm not going to tell my story. And we learned a lot from them that you do need to, not to the whole world, but to tell your story, right? So they can help you, work through it and help you through a lot of the moral injury and the other things that come from that service.
Thanks, Jim.
I wish there were more information to the general public about what you do, because I know there are a lot of people that suffer from PTSD. I work for a nonprofit, and what we do is help people transition from being homeless into sheltered housing. We provide the furniture. So I was working with a gentleman who had been a sniper in Desert Storm, and he did not get an honorable discharge. He had a little altercation with his CO.
Sure.
And of course that did it, but he had two. The CO basically told him that man up, because they didn't know anything about PTSD. So he manned up for about 3 more months and just couldn't take it. Had the altercation, they threw him out, and he's been living on and off the street ever since. And he's not a young man, because Desert Storm was quite a while ago. So what I would like to ask you is, do you have information at your table that I could get afterwards to give to this gentleman to see if I can get him some help?
Yeah, Claire Male, she's our Office of Director of Development for Marcus Institute. She's put flyers on all the tables. So there's 3 things that are on the table. There's one that talks about, like, if you have any, what our mission is and the impact we've made, as well as how to get people to come to it as well. Yeah. And so there's a book called Lethal Warriors that was written about in Fort Carson, and specifically a lot of people who came back and they were labeled as bad soldiers and kicked out. And so part of it is we realized that they were suffering and we didn't meet their needs and didn't support them. So that's one of the reasons for us. You don't have to have that honorable discharge because we know, people were suffering. Thank you for that question.
Do the veterans who qualify for your program have to be sober?
Yes. So part of it is our team intake works really hard with our team. Our intake team works really hard with the patients because we want to assess them. If they're on drugs and alcohol, we're not assessing their baseline, we're assessing the alcohol or the drugs. And so our team, usually if you use alcohol once a day, we want you sober for a month. If you use it once or twice, we have a little sheet that we share with the patients. We also have 5 other organizations like us across the United States. We're the only one east of the Mississippi that modeled after us. We're part of the Avalon Action Alliance. And within that, they also have 2 drug and alcohol treatment facilities called Warrior's Heart. So sometimes we ask them to go to that first. Sometimes we have another partner that's called Warrior Path, and this is open to all first responders, military, and veterans, that is really post-traumatic growth. And I've found, and I've gone to that myself in the Pacific Northwest, if they go to that, they learn how to trust and how to show vulnerabilities. So when they come to us, they're a little bit more down-regulated, they learn some wellness practices, and they're usually more receptive. So yes.
So, General, thank you very much for the presentation. We get the last word here at Boulder Rotary, and part of that is to thank you for your time and your information. I spent 36 years in law enforcement, and you said it well when you said we didn't know what we didn't know.
Right.
Back in the 80s, you rubbed a little dirt on. I'm so glad you're doing and what you're able to accomplish now. Missions for decades has been to end polio, and in your honor as a thank you for being here, the polio vaccine to that cause.
Oh,
thank
wonderful.
you so much for
Thank
today.
you. I'm so honored. I'm so honored.